welcome back to our Women Crush Wednesday interview series. I'm Mansi, one of the outgoing women's officers within UNSW MedSoc, and today I'm here with the lovely Dr. Julia Thompson, who is a consultant neurologist. So our first question for you today is, what inspired you to become a neurologist?
That one's an easy but also a tough one. I'll have to admit to everyone is that I never actually planned to be a neurologist, particularly in med school. And in fact, up until I had to choose advanced training jobs, it was very much down the bottom of my list. It seemed very difficult. People used lots of weird terms that I didn't quite get my head around. The terms, when you did them as a junior doctor, seemed to be largely a large amount of paperwork and discharge planning. And it wasn't until I was a registrar and really got that opportunity to start actually understanding it, and understanding the conditions face to face, understanding the actual role of a neurologist, because in hospital you get a little bit of experience about the job, but you're not actually exposed to the lion's share of what each specialty is. It's a very small snapshot. And as a registrar, you're, I guess, an apprentice, a trainee, and you get to see what your bosses do. And doing that and watching the people as an outpatient, the inpatient medicine, and understanding the conditions and then being able to translate that to patients and see the benefit of taking the knowledge that you suddenly understood and the fact suddenly you realized how interesting it could be, and then we're able to translate that to patients. That's what I really enjoyed. It was also embarrassing to me at the time, the one area after I did it as a BPT that you didn't have to force me to study just because I had an exam coming. It was something where I would see a New England Medical Journal pop up, or we would divide up questions as BPTs. And I would be very, very happy to go, I'll just do the neuro ones. You know, I was doing the term anyway. I never really realized, though, until I had to choose a job. And when people were offering me different advanced training positions, wanting to know what I wanted to do, I missed the job I had been doing and I kept looking up about the patients that I had seen, kept wondering what happened to them. It's difficult to know as a med student what you want to do. You think you do, and then you do the next term and you think you want to do that. And the truth is, it's okay to change your mind all the time. I did a few times. I actually started out doing a different training program and then went to BPT. I just made the mistake. I thought I knew what a job entailed. It didn't, and very happily swapped over. And lots of people I know have done the same. No experience is bad. Every time you get excited about a term or think something's interesting, it's because it is interesting. It's still medicine, and every patient has more than one thing wrong with them. And every system involves every other system. So nothing is ever lost. That's the beauty of medicine, that it is an apprenticeship. You're finding your way along. You get only little snapshots at a time. So it is difficult to know where you fit. I encourage people not to be dismayed if they choose the wrong thing along the way or don't know what they want to do when they finish med school. I think it's even better. I think it's better just to go, I am an intern. That's what I have become, and go from there. In Australia, there are people who retire in their 70s and 80s. There is so much time to go. I really encourage people that if they don't know what they want to do, that's okay. And they just take the time and take years off, do whatever needed to know where they fit in the world. One person I know who did surgery, and the last year before they almost fellowed, they went and became a dermatologist. Imagine the skills they got. Imagine going to them to get a skin cancer cut out and the surgical skills they acquired. The truth is, though, even if something had negative experience, you actually learn how to navigate negativity, to navigate bad systems. You've learned how to navigate, I guess, difficult pathways, and you've matured. You won't realize you have at the time. It's like bad relationships, it's like so many things. At the time, we just can't see the wood for the trees. There are so many patients opposite you who've been through that or are going through that. Empathy matters so much more than sympathy. And the ability to look at them going, yep, I know what you're talking about. That's just going to compound and add to what they know.
We've read that you have an interest in pregnancy and women's neurology. What sparked your interest in that particular area?
The big thing that's going to sound really obvious is that not all humans are men. But then when you look around at consultants, There is quite a bias, of course, to those that are ahead of us. Times have changed very rapidly. But whenever a woman is going to the doctor, she might want more than one option. I, doing epilepsy as a fellowship and then doing headache term as a fellowship, was often assigned the female patients. I then found that it was much easier to talk to them about medication side effects because I could understand what their fears were. I'm talking about, will it affect menstrual weight gain? Will it affect them if they're pregnant? What about if they're worried about their hair loss? What's the difference between alopecia and shedding? The big thing though, and I'm in a male dominated specialty at the moment. A lot of the juniors fortunately aren't, but I am in a male dominated specialty, which very much welcomes women. But a lot of women would like the option of having a female doctor. So I tried to upskill in the areas that would enable that, the conditions that affect women more than men, so that I could be someone that then welcomed that, but also train people below us, both men and women. There is absolutely no reason that a male doctor couldn't be as good managing a female condition. Of course not. Women should just have the choice, same as men should have the choice, whether they see a male or a female doctor. When I was in England, the women in neurology sort of clinics where OBGYN and neurology would work with each other. Most of it, again, was headache and epilepsy and pain. But I found it very, very helpful to be able to talk with them about the pregnancy, talk through the issues. And then later on, myself, although I wasn't necessarily planned. I certainly do have a son. And during pregnancy, I got to experience what it's like to be on the other side. And actually, then spent a lot of time by choice with midwives who worked in the subspecialty area to try and learn from them about what they should be teaching me if I had a headache, if I had this, if I needed certain, prams that patients with epilepsy would choose. Because I didn't realize that some prams have automatic braking systems and others don't. These things you're not taught. You don't come out with a manual. There's no thing that says you're a woman, you're just going to know all this stuff. And you look to your medical professionals, whether obstetrician, GP, neurologist, someone to tell you. And it is our job. It is not my job because I don't feel like it. It is all of our jobs to impart the knowledge. It's better that someone hear it from everyone than from no one. The biggest way of changing a culture, changing a system, is to just do it, to change it. It's not worth talking about, it's not worth pretending, it's just to do it. And that way, if we're able to just impart the knowledge to one person, then there's one more person who will tell that patient, regardless of the specialty that they do. It's the key thing. It's actually to try to learn more about what the patients might need, what they might go through, because it is a job, it's true, it is a career, but it is interesting. And it's as interesting as you make it. And the more you question what you do, the more you'll think about the answers.
We know you spent a lot of time working and studying in England. So, what was it like
Yes.
doing research at Oxford University?
Oxford was wonderful. I went as a neurology fellow, so I finished the training in Australia, and then this was a scholarship program, not an exchange, but something similar, where the Royal College of Physicians sort of helps you to get there. Because, of course, in a lot of these situations, the tough bit is, how do I do it? How do I go to the US? How do I go to the UK? What's the process? It was so good. I must admit, I had absolutely no idea what I was getting myself into in terms of the NHS. We sort of get allocated these places. So I was given Oxford and thought, wow, I have heard of Oxford. And I, as a humble Australian, was thinking, oh my gosh, they'll be too smart for me. When I went there, it was such a wonderful opportunity. It was easy to fit into the system, to fit into the NHS. It was such wonderful people at the university. And it also made me realize how good our training is in Australia. Because actually, being there, not to make you all feel sad, you'll get very demystified when you're there and realize it's just another very good university, as is Cambridge, as are a lot of places overseas, but also as are the University of New South Wales and Sydney and similar places. I was at Green Templeton College as part of Oxford University. I taught there. I taught medical students. I was a tutor and lecturer. And I would never have thought, year 12 version of me would never have thought that would happen. But at the same time, when there, it just seems second nature. It seems just as it will when you're in Sydney and it's your University of New South Wales students. Doing the research there was initially part of the job, and then I extended it. And it was so beneficial for me because I had only done a little bit of research in Australia. Realistically, it were case studies people had handed me to do. And I thought, sure, it's my job. I'll do it. I'll put it on the resume. And then when I was in England, it was my own questions. I wanted them answered, and a very good supervisor, someone very eminent, actually said, sure, well, why don't we expand your questions into projects? And I really enjoyed it. And it's important you choose the right research because it'll get really tiresome at some points, and it can blow out, and it can be very, very tough when you're trying to submit lots of papers before other people do to the top journals. If you're enjoying the topic, if you find it a really interesting concept and idea, then it will fuel you to keep going. If you get the chance to go overseas, take it. I have to admit, I am better for it. I sort of cringe to think what it must have been like before, because certainly going there, you get a bit of a shock as to how insular Australia can be in many ways. I had been fortunate to go to a lot of the top hospitals in Sydney, but it's also really nice to get off this weird treadmill that exists in your home country, this one way of doing things. And there's no one's ever told us there's one way, but gosh, we seem to fall into this pattern. And it was really wonderful to get off it and start designing your own journey and realizing the world is bigger, realizing medicine is bigger. And I think it's very good to sort of help your mindfulness, help your own mental health, because it can get so insular at times. It can get really distressing that you're not meeting perceived milestones that don't exist. And when you're away from it, when you realize the world is bigger, you stop sweating the small stuff. You just learn to sweat the big stuff, and you travel and you enjoy it. And people in England take 6 weeks of annual leave, and they make sure that plus every long weekend they're overseas, and you do it. You do exactly what they do, and you realize, sure, I can take holidays. Whereas it's almost like we're encouraged not to in Australia, but no one's ever said that. And it's very strange. It's a cultural thing. No workplace has ever said, don't take leave. I've never had anyone refuse it, yet it must just be built into us that we all think, oh, don't take holidays, just keep working and I'll get a gold star. But it's not the case. At the end of the day, it's a job. And as much as we like to glorify it and think, this is me and my life, it's not. It's a job. It's a wonderful job, but it is still a job.
Do you have any tips for students who might be interested in doing research or further study abroad?
I do. So I did an elective overseas in an exchange because it was offered through my medical school. And so yeah, sure, why not? And so I did one in the US at Columbia University, and that was fantastic. And then I went to Africa with a group of friends, and it was again fantastic. And you save up all your pennies in the university holiday, and you spend every single one of them. And it was actually really good. The key is to look into the opportunities. It doesn't matter when you do it. In fact, it's absolutely easier to do it near the end for fellowship. So if you're worried, and it's very hard, I mean, not everybody has, oodles of money. And as an intern, you certainly don't. You don't have to do it at any particular point. You can still take years out and travel too, as long as the Australian government will allow it. You can do this at any point. And as a student, everyone's on a different journey. Everyone has different amounts of money. Everyone has different priorities. Some people have families and kids. You don't have to do it then, and you don't have to even go overseas to do it. So if there are people who are thinking, oh, well, I'm not sure it can be me, I have family, we won't necessarily be able to move. Some can, some can't. It can just be interstate. Experience is experience. When you think you might like to do it, go and talk to people. Well, a lot of people talk to me. And British people who want to come to Australia contact me because I still sort of partially work there. Likewise, I get a lot of students and young trainees asking me, and we can put people in touch with people. There's ways of knowing someone who might know someone and might be happy to take an elective student, an RMO equivalent. The truth is, when students say, oh, it's never been offered, well, no one asks. And if you think you want to do something, just ask. If we don't seem to be interested in talking to you, we're probably all in our head thinking of our to-do list, same as you guys are. But truthfully, if you turn and ask, we might have really good options or ideas, or at least know where to point someone. And if it's something you're really keen on doing, definitely do it. Don't put it off. But if you're worried, it's much, much easier when you finish whatever training program in whatever you do, because then there are these fellowships which are much easier to get to when you finish something in Australia. It's the easiest point, regardless of the specialty.